What is insomnia and how is it treated through cognitive behavioral therapy? Insomnia is defined as a difficulty falling asleep or staying asleep even when given the opportunity to do so. People with insomnia often experience fatigue, low levels of energy, difficulty concentrating, mood disturbances, and performance issues at work or school. There are two main types of insomnia: acute and chronic. Acute insomnia is characterized by brief periods of difficulty sleeping, usually related to stress, travel, significant life changes, and it usually resolves itself without treatment. However, chronic insomnia is defined as a long-term pattern with difficulty falling asleep and staying asleep lasting for 3 or more times per week, over a course of 3 consecutive months or longer. Insomnia has many causes. It can be caused by psychiatric or medical conditions such as allergies, sleep apnea, asthma, neurological conditions like Parkinson's disease, or arthritis. Other factors include unhealthy sleep habits, substances, or biological factors. Insomnia is a very common disorder, and over time, it can lead to severe depression and/or anxiety. So now that we have a better understanding of what insomnia is and some of its causes, let's talk about how CBT insomnia therapy works and the role that it plays helping people who are struggling with their sleep. First, let's look at the cognitive part. It teaches you to recognize and change beliefs that affect your ability to sleep. This type of therapy can help control and eliminate negative thoughts and worries that keep you awake. The behavioral part helps you to develop good sleep habits and avoid behaviors that keep you from sleeping well. There are 6 techniques that sleep therapists may recommend based on clients' needs: stimulus control therapy, sleep restriction, sleep hygiene, sleep environment improvement, and relaxation training. Stimulus control involves removing specific factors that dissuade sleep and set specific criteria like set bedtime, wake times, and avoiding naps, and using bed for sleep purposes only. Sleep restrictions limits initial amounts of time that you spend in the bed, causing partial sleep deprivation. This in turn leads to tiredness and essentially resulting in better sleep. Sleep hygiene encourages clients to change their sleep habits, such as reducing their caffeine consumption or alcohol consumption, exercising regularly, or winding down a few hours before they actually go to bed. Sleep environment improvement offers suggestions on how to change your physical space. Relaxation training focuses on calming the mind and body through meditation, music, and imagery. Other techniques may include remaining passively awake, using the reverse psychology method to trick the mind on focusing to stay awake to relieve the pressure of falling asleep, and/or biofeedback, and how to adjust them to develop better sleep patterns. Unlike pills, CBT addresses the underlying causes of insomnia rather than just relieving the symptoms, but it takes time and effort to make it work. In some cases, a combination of sleep medication and CBT may be the best approach. Sleep therapists will tailor a program designed to fit the individual's needs and lifestyle. Some insomnia will be cured in as little as 2 sessions, where others will need more. CBT has been proven very effective with helping individuals with insomnia. It also relieves some of the subsequent problems with anxiety and depression. Essentially, persistence is key. Some of the therapies can cause initial sleep loss, but result in long-term gain.